Hey there, beautiful souls. I'm Dr. Anna Schneider, your friendly back pain warrior with over 15 years of experience helping people just like you take charge of their bodies. Today, we're diving into something so many of you incredible women have asked me about: pregnancy back pain relief. If you're pregnant, or know someone who is, and that nagging ache in your lower back is stealing your joy, stick with me. This isn't just another list of tips. This is your roadmap to feeling strong, proud, and in control again, because you deserve that, mama. Pregnancy is a miracle, right? Your body is creating life. But let's be real, it's also a wild ride, and back pain can feel like an uninvited guest crashing the party. I've seen it all in my practice: the wincing, the sleepless nights, the frustration. But here's the truth I want you to hold on to: you're not powerless. You've got this. With a few simple, science-backed strategies, you can ease that pain and reclaim your confidence. So, grab a comfy seat, or a pillow if you're already feeling that ache, and let's get started. I'm here as your guide, your cheerleader, and your friend. Oh, and before we dive in, hit that subscribe button and ring the bell. I've got so much more to share with you. Let's do this together. Ready? Here we go. Let's start with the basics, because understanding why your back hurts is the first step to kicking it to the curb. Picture this: your body is a masterpiece, adapting every day to nurture that little life inside you. But with that miracle comes some serious shifts. As a doctor, I've seen how these changes can throw your spine for a loop, and I'm here to break it down for you in a way that makes sense. First, there's your growing belly. That beautiful bump shifts your center of gravity forward. Your lower back, your lumbar spine, starts curving more to keep you balanced. It's called lordosis, and while it's totally normal, it puts extra strain on those muscles and ligaments. I've had patients tell me, "Dr. Anna, it feels like I'm carrying a bowling ball." And you know what? They're not wrong. That weight adds up. Then, there's the hormone party happening in your body. Relaxin, a hormone that loosens your ligaments to prep for birth, kicks into high gear. It's doing its job, but it also makes your joints and spine less stable. Combine that with stretched abdominal muscles that can't support your back like they used to, and bam, you've got a recipe for discomfort. Let me tell you something I've learned over the years: this isn't a flaw. It's a sign of your strength. Your body is doing something extraordinary, and a little ache is just proof of how hard it's working. So, next time that pain flares up, give yourself a pat on the back, figuratively, of course, unless you've got super flexible arms. Here's a quick question for you: when did you first notice your back pain? Was it early on, or did it sneak up later? Drop it in the comments, I'd love to hear your story. Now that we know the why, let's talk about the how to fight back and feel amazing again. Okay, let's get into our first game changer: posture. I've seen this transform lives in my practice, and it's so simple you'll wonder why you didn't start sooner. When you're pregnant, slouching is tempting, especially as that belly grows, but it's like handing your back pain a megaphone. We're going to turn that volume way down. Here's the science: good posture aligns your spine, reduces strain on your muscles, and helps distribute that baby weight evenly. Think of it like building a strong foundation for a house. If the foundation's off, everything wobbles. Same goes for your body. So, how do we do this? First, stand tall. Imagine a string pulling you up from the top of your head. Shoulders back, chest open, not like a soldier, but like a queen owning her throne. When you sit, use a small pillow or rolled towel behind your lower back. It supports that natural curve and feels like a hug for your spine. I tell my patients, you're not just sitting, you're reigning supreme. Now, I get it, standing or sitting like this might feel weird at first, especially if you're used to hunching over a phone or desk. But trust me, your body will thank you. I had a patient, Sarah, who was 7 months pregnant and miserable with back pain. We worked on her posture for just a week, and she came back beaming, saying, "Dr. Anna, I feel like me again." That could be you. Here's a little challenge: try this right now. Sit up, roll those shoulders back, and take a deep breath. How does it feel? Let me know in the comments, I'm rooting for you. And if you're wondering, Dr. Anna, what about when I'm waddling around all day? Don't worry, we'll get to movement next. Posture is your foundation, build it strong, and the rest falls into place. Let's keep this energy going, on to tip number 2. Alright, let's talk movement. I know what you might be thinking, Dr. Anna, I'm exhausted, how am I supposed to exercise? Hear me out, because this isn't about running marathons. It's about gentle, purposeful moves that strengthen your back and lift your spirits. You're not just a pregnant woman, you're a powerhouse, and movement is your secret weapon. Why does it work? Exercise boosts blood flow, eases muscle tension, and strengthens your core, yes, even while pregnant. A strong core supports your spine like a built-in corset. Studies show that women who stay active during pregnancy report less back pain and recover faster postpartum. I've seen it in my clinic time and again. So, what moves are safe and effective? Let's start with pelvic tilts. Lie on your back, if that's still comfy, or stand against a wall. Gently tuck your pelvis under, like you're flattening your lower back, then release. Do 10 reps, slow and steady. It's like a mini massage for your spine. I had a patient, Maria, who swore by this. She'd do it every morning and said it was her pain eraser. Next, try cat-cow stretches. Get on all fours, arch your back up like a cat, then dip it down like a cow. Flow between them for a minute. It loosens your spine and feels so good, I'd even caught myself doing it after a long day. If you're farther along, a prenatal yoga class or seated stretches work wonders too. Check with your doctor first, of course, I'm all about safety. Here's the motivation part, every move you make is a victory. You're not just easing pain, you're showing your body who's boss. That's power, mama. So, what's your favorite way to move? Walking? Stretching? Share it below, I'd love to cheer you on. Ready for more? Let's keep the momentum with tip 3. Now, let's talk about some instant relief tricks, because sometimes you need a quick win, right? Heat and cold therapy are my go-tos, and they're so easy you'll wish you'd tried them sooner. Plus, we'll throw in a little support, literal and figurative, to keep you feeling unstoppable. Heat is like a warm hug for tight muscles. It boosts blood flow and relaxes those knots. Grab a heating pad or a warm towel, place it on your lower back for 15 to 20 minutes, and just breathe. I've had patients tell me it's like melting the pain away. Science backs this up, heat increases flexibility in your tissues, making movement easier too. Cold, on the other hand, tackles inflammation. If your back feels swollen or sharp, wrap an ice pack in a cloth and apply it for 10 to 15 minutes. Alternate heat and cold if you're feeling adventurous, it's like a spa day at home. I remember a patient, Lisa, who was skeptical. She tried heat one night and texted me, Dr. Anna, I'm a believer. Small wins like that add up. And don't sleep on support, literally. A pregnancy pillow or a firm mattress can work wonders. Sleep on your side with a pillow between your knees to align your hips. It's a game changer. Oh, and during the day? A maternity belt can lift some of that belly weight off your back. Think of it as your personal assistant. You're stronger than you know, and these tools just amplify that. What's your go-to comfort trick? Heat? A cozy pillow? Tell me in the comments, I'm all ears. Next up, we're diving into something you'll love, tip 4. Okay, this one's close to my heart, your mind. Stress doesn't just mess with your head, it tightens your muscles and amplifies pain. As a doctor, I've seen how a calm mind can transform a hurting body, especially during pregnancy. You're not just carrying a baby, you're carrying dreams, hopes, and maybe a little worry. Let's lighten that load. Stress triggers cortisol, a hormone that tenses your muscles. Ever notice your back hurts more when you're anxious? That's why. So, let's fight back with some calm. Deep breathing is my favorite. Inhale for 4, hold for 4, exhale for 4. Do it for a minute and feel your shoulders drop. It's science. This slows your heart rate and tells your body, we're okay. Meditation works too. 5 minutes of focusing on your breath or a happy thought, like meeting your baby, can shift everything. I had a patient, Emily, who started this at 32 weeks. She said, "Dr. Anna, I didn't realize how much I was clenching." She found peace, and her pain eased up. Here's the kicker, you're not weak for feeling stressed, you're human. And choosing to relax? That's strength. So, try this, close your eyes, breathe with me now, and let it go. How did that feel? Share it below. I'm here to celebrate every step with you. One last tip, let's wrap this up strong. Last but not least, don't go it alone. I've seen too many women try to power through pregnancy back pain solo, and it breaks my heart. You're a warrior, but even warriors have allies. Building your team is key to thriving. Start with your doctor or midwife, tell them about your pain. They can rule out anything serious and tailor advice to you. A physical therapist or chiropractor trained in prenatal care can work miracles too. I've sent patients to PT and watched them walk out taller and happier. Massage therapists? Yes, please, prenatal massage is safe and heavenly. And don't forget your people, your partner, family, friends. Ask them to rub your back, grab you a pillow, or just listen. I tell my patients, you're not a burden, you're a priority. You deserve support, so claim it. Here's my challenge, reach out to one person today. Tell them what you need. Who's on your team? Drop their name in the comments, I'd love to give them a virtual high five. There you have it, my friends, your toolkit to conquer pregnancy back pain. From posture to movement, heat to support, mind tricks to teamwork, you've got everything you need to feel proud, powerful, and pain-free. I poured 15 years of heart and science into this because I believe in you. You're not just surviving pregnancy, you're rocking it. Now, I want to hear from you. Which tip are you trying first? How's your back feeling today? Drop it in the comments, I read every single one, and I'm here to cheer you on. Oh, and tell me where you're watching from, what city or country. Let's connect this amazing community of strong women. If this helped you, smash that like button, it tells me to keep bringing you more. Share it with a mama-to-be who needs a boost, and subscribe if you haven't already, I've got tons more coming your way. Together, we're unstoppable. Until next time, keep shining, keep moving, and know you've got this. I'm Dr. Anna Schneider, your back pain bestie, signing off. See you in the comments.